And I'd like to welcome you all to our Thursday 1:30 p.m. session with Tori Goldhammer. We'll be covering reviewing typical changes in our bodies as we age. And thank you so much for coming on to our session today. I'm going to read our disclaimer before we get started. The WildTech DC Senior iPad program, its owners and presenters offer technical assistance, virtual health well-being information designed for educational purposes only. You should not rely on the information in any applications or topics made by WildTech, including but not limited to mobile device applications and any social media pages maintained by WildTech, its owners, or presenters as a substitute for professional medical advice, diagnosis, treatment, or legal advice. Thank you so much for letting me read the disclaimer. If you cannot see us, hear us, or see the screen, please let us know in the chat, which you can access and more. I always recommend you have a pen and paper next to you so you can write down any notes that you would like to review for later. And please make sure your TVs and cell phones are silenced to the best of your ability to give others, and most importantly, yourselves, the most immersive experience. Again, today we have Tori on, and she'll be covering what she'll be covering today and the fashion that we're doing. So thank you so much all for raising your hands. You all can lower your hands by hitting lower at the bottom. And don't forget, if you have a question, please raise your hand in Zoom. Again, Tori, if you could introduce yourself and what we'll be covering today, we appreciate it. And thank you all so much for coming on to our session.
Thank you, Alex. Hi, everybody. I'm Tori Goldhammer, an occupational therapist working in the community to help, to help people stay in their homes and live as healthy a life as we possibly can. So today, what I wanted to talk about is what happens to our bodies naturally as we age. And the reason I wanted to talk about this, and I'm happy that it was a topic that came up in the survey that you are interested in as well, is because I think it's important to understand what's happening to our bodies and also what we can do, either changing our behavior or maybe taking some steps towards better health that we can learn and grow and move with these changes, okay? Because they're happening whether we like it or not. So, so let's talk about them and see what we can do to try to still live a full life despite what's happening as we get older, okay? It's a lot of information. As always, I think I go over because I like to make sure that we have a conversation. Maybe we can take 5 minutes. Last time we talked about nutrition and like just why don't we open it up for like 5 minutes of comments, questions, anything that's come up since I last saw you guys in May, if that's okay.
I'm sure, Tori, does anybody have any questions for Tori about anything that she covered last time about nutrition? Any questions from the last presentation before we get started? I don't see any hands so far, Tori.
Right.
I think we can go ahead and get started with the exercises, right?
Okay. So today I found a 7 minute seated cardio exercise video for us to do that I would like for us to do. Please make sure that you're sitting somewhere. Yeah. Willie Mays. Please make sure you're seated somewhere comfortable. Again, you're exercising to your own comfort level. So if anything hurts, if you're feeling short of breath, dizziness, anything like that, please stop. It's a very gentle exercise, so it shouldn't be too much trouble, but please mind your own bodies. I remembered from last time that there was a question about doing exercises for people who have had strokes and maybe have weakness on one side. So I found some physical therapists who have online videos for people with one-sided weakness. So I'm going to share that link in the chat so that the people that that's relevant for can follow up and do those exercises, okay? So let me get my video ready for today, however. Share my screen. All right. All right, here we go. Can everybody see that?
You're good to go, Tori. Thank you.
All righty.
Much for joining me today on Senior Fitness with Meredith. So today's workout, part of our cognitive fitness series, we are doing our slow seated cardio workout. So what you will need, that sturdy, comfortable chair, a little bit of space around you, and make sure you have your water close by, always taking breaks when you see necessary. So we'll be doing 10 movements, nice, slow, and controlled, focusing on getting our heart rate slightly up in a cardiovascular way, all while staying seated. So I'll give you a minute, grab everything you need. I'll meet you right back here, and we'll get started with our cognitive fitness series, slow seated cardio. Welcome back. We are ready to get started with our slow seated cardio. So let's just start with a nice slow march. We're scooched up to the front of our chair. I want you to pull in through those abdominals, lengthen your spine, shoulders relaxed and down. Just marching nice and slow. Right foot up, left foot up. Breathing. Exhaling and inhaling, staying nice and tall in your chair. Let's do 3 more each side. 2 more. Last one. Now I want you to tap to the front. So tap right foot front, left foot front. Tap and press. Tap and press. Exhale, inhale. Tap and press. 2 more each side. 2, 1 more. Right and left. Go back to our march, and we're going to curl our arm up. So opposite arm, opposite leg, curl. Curl. Good job. Go at your pace, taking breaks when you need to. Three more on each side. 3, 2, 1 more. Right, left. Now let's tap it out to the side. So tap to the side, come into the center. Tap to the side, center. Tap, center. Remember, keep your abdominals pulled in nice and tight, pressing everything out to the side now. Tap, center, tap, center. 1 more right, 1 more left. Back to our march, bringing those feet up. Now press to the front. Press, press, press. Breathe with it. Don't hold your breath. Exhale. Two more. 2, 1 more on each side. Now a little diagonal step, so that right foot goes to the right, pull it in, left foot left, in. Right and left. Right and left. Good job. Three more each side. 3, 2, 2. Last one right. Last one left. Back to that march. Right foot up, left foot up. Now we're going to alternate bringing arms up in front, little front raise. Right side, left side. Stay nice and tall. Try not to lean back in the chair. Let's do 2 more, each side. Last one right, last one left. Good job. We're gonna open to our sides now. So open out right, open out left. Open, open. Good job. Arm and leg opening right and left. Three, 2, 2, 1 more each side. Right, left. Back to marching the legs. Right side, left side. Gonna bring our arms out at our sides. We're gonna give ourselves a nice big hug. So bringing the arms across the body, squeeze in tight, big bear hug. Should feel nice. We're gonna open those arms up nice and wide again. And let's give ourselves another nice big hug. Squeeze in tight, you're doing such a good job. We're gonna open those arms again nice and wide. Let them release down onto your lap. Keep the legs marching. 2 nice big deep inhales and exhales. Inhale those arms up. Exhale them down. Let's do 1 more big deep inhale up. And exhale down. Keep those legs marching just for 5, 4, 3, 2, and last one. Great job. You just completed your slow cardio seated workout, part of our cognitive fitness.
Okay. That was a whole lot of marches. How'd everybody do? Any problems? Any comments? You'll notice that she said this was part of their cognitive series. I didn't look specifically what that's about, but I think we've talked before that exercise is good not only for our muscles and our bones and our balance, but it does have there are positive cognitive effects from exercising. So if you'll notice that she did a lot of arms and legs at the same time, which both help with cardio, but also the coordination of following her and doing those movements also can have a good impact on our cognitive. Mr. Just moving is great. It is. It is. So I'm going to put the link for this particular exercise video in the chat. And then again, I'm going to put the one for the ones for hemiplegia, which people who have had a stroke and have one-sided weakness. I'm going to put that link in the chat as well.
Thank you for both, Tori. Appreciate it.
Yeah. So if no comments or questions about the exercise, we'll move on to the presentation for today. All right. All righty, guys ready? A lot of information. Get it ready. Let me get it pulled up. There we go. Okay. So again, this is the topic of this conversation are changes as we mature. Excuse me. These are physiological changes in our body. And all of the information that I'm presenting today is from this resource. It's the Merck Manual. So the Merck Manual was a textbook, I think it probably still is, that has been it has been the quintessential medical textbook for a very, very long time. So the information is presented, it's evidence-based, it's based on research, and it just describes about our bodies. And physicians rely on this as well for diagnosis and working with people, but we're just going to use the information that's relevant to us, okay? So again, as Alex already said from WildTech, and I'll say, as I say for myself, I'm not a physician, I'm not a primary care provider. Please, if you're going to make any significant changes in your diet, certainly your medication, exercise, any of those things, please talk to your primary care provider. But let's move on. So as we get older, things change, right? Like that's not news to you guys. I know you know it. But we're going to start with the organs. So basically, as we get older, all through our lives, cells are dying and cells are being regenerated all the time. We are changing every millisecond. Our body is changing from the day we were born till the day we pass. That's happening all the time in our bodies. As we get older, however, we have less new cells being produced. So basically, we have less cells happening. So you can see that there's less active cells in some of our organs, like our testes and our ovaries, which are our sexual reproduction organs, our liver and our kidneys. And we're going to talk about all that. None of this is to be afraid of. It's very small and mostly not affects anything, but it happens, okay? Good news is that our brains actually do not lose many cells. One of the most important organs that's not happening. But let's get into some of the organs. The good news is, even though we have a decline in the number of cells, our bodies are designed to have a reserve. So we start out life, the organs start out with more than enough cells. So even though we're losing some, there should be more than enough to make us to the end of our life. What happens is, if we have a disorder of some sort that's affecting those organs, that's when things start to go awry. But if our health is good and we're living a healthy lifestyle and whatever we can control, we should have more than enough cells for those organs to continue to function totally fine until we're ready to go. However, because of those changes, they are a little less able to handle various stresses. And this is really important particularly for today and this upcoming weekend. Things like extreme temperature changes and strenuous physical activity, we're not going to handle those as well. And that's going to come up later on in the presentation as well. So, you do still need to be aware about some changes that are happening, right? And because of our liver and our kidneys starting, having a little bit less function or a little bit of decline in the number of cells, you might also experience side effects from your medications more so as you get older than you did when you were younger. So just be very aware again. We've talked about mindfulness before. Just be very aware of how you're feeling, because there is a chance that, because you may be feeling things that you didn't feel a couple of years ago. All right. If anything is extreme, of course, talk to your physician about it. Bones and joints. So we've talked a lot about bones and joints, but I just want to make sure we go over these. Our bones become less dense as we get older. So what does that mean? If we fall, we're more likely to fracture, right? Even if we don't have osteoporosis diagnosed, we still are going to be at higher risk of fracture as we get older. If you can see towards the bottom there, well, the reason why is because our body is not absorbing calcium as well as it used to. And we also have typically a decrease in vitamin D. So those two things are contributing to less bone density. And if you can see from the bottom there are some particular bones that are more susceptible than others. And that's your thigh bone at the very top at your hip. So this is why I think we see a lot of fractures, hip fractures. The ends of your arm by your wrist. So if you do reach out, if you're falling and you reach out with a bent arm and hand, as we've talked about, you're more likely to fracture. and your spine. And you may know people that like their spines are starting to have what's called compression fractures, which as we get older, we have these little, little fractures, little small fractures in our vertebrae that start to compress. And then that starts to compress the nerves. And then you have problems with weakness and decreased sensation. So all these things are happening, which is why it's so important that we do what we can to maintain our bone health. In addition, our cartilage becomes altered. You may already know this, like there's less sponginess between your bones and your joints. And this is what's leading to arthritis. And your joints may become stiffer. We've talked about this, and the stiffer joints what will limit your range of motion. All right, so I've got a question for you. I probably should have done this as a poll, Alex, but I didn't. So maybe people can just raise their hands. But we've talked in the past about a specific joint that I've encouraged you to try to keep flexible. Does anybody remember what that joint is?
Yep, please raise your hand if you remember.
I think I can't see hand raises, Alex. Oh, I
Yep.
see. And Ms. Dennis,
Yep.
okay.
And what is your answer?
I kept hitting the thing, it wouldn't unmute. I thought it was your knee joints.
Your knee joint. Okay. So yes, it's important to keep your knee joint flexible, but that's not the number one that I've talked about in the past.
Okay. Sorry. Your
That's
heart
okay.
muscle.
Thank you for trying, Ann. We really appreciate it. Mr. Harrell, what do you think?
Why don't you try your ankle bone?
Yeah.
Ankle joint.
Ankle joint, right, Mr. Just that's the one that commonly becomes the stiffest, and is fortunately one of the easiest ones to maintain the range of motion. So every day, circle your ankle, write your name, write the alphabet, do toe pumps, and we can go over that when the presentation's over again, but it's very, very important to keep your ankle range of motion flexible. Thank you, Mr. Jett.
Great job, Mr. Harrell. Thank you.
So let's go into muscles and body fat. So I have talked about this before. I'm not reading all these words for sure. But as we get older, as you can see, it starts around age 30. So this has been happening for quite a while for some of us. We start to lose muscle mass and muscle strength. I know that's not a surprise for you. But the good news is that research continues to show that regular exercise can delay this loss. So again, I'm going to emphasize exercise a lot in this presentation, but it is happening. So it's important to just, acknowledge that and do what we can, right? So what the research is showing is that typically in an adult lifetime, if you don't have any difficulties, you lose about 10 to 15% of your muscle strength. So that's really not so bad, frankly, because honestly, if that's all you lost, you should still be able to walk, climb the stairs, transfer in and out of tubs. It's really still very functional to have lost that amount. And as you can see, the second part, in the absence of disease, most of the loss beyond that 10 to 15% is preventable with regular exercise. So again, if you exercise, you're going to mitigate anything beyond what's happening naturally to your body. If I'm going too fast, slow me down, because this is something I'm excited about. And when I get excited, I talk fast. Okay, another change in our muscles. So you may be familiar. You may be familiar that we have different types of muscle fibers in our body. We have slow twitch and fast twitch. And as you can see, the numbers of ones that contract faster decrease more than the slow ones. So what does that mean? That means that they're not going to contract as quickly as we age. What does that mean? That means that our reaction is not going to be as quick as it was when we were younger. Does that make sense? So those muscle fibers that you need to contract quickly, maybe to catch yourself if you're losing your balance or something like that, they're not working quite as fast as they used to. So this is where that mindfulness thing comes in. We want to kind of really try to avoid situations that we have to react quickly if we can. All right. All right. So regular exercise to strengthen muscles, the same thing again. So if exercise to strengthen your muscles, and this means, doing a little bit of resistance training, whatever you can, if it's using a can of soup for some resistance, if it's using little dumbbells, if it's using those bands, even if it's your own body weight, if you can do squats, that kind of stuff, using resistance against gravity is really, really, really helpful. And as you can see there, if it's done regularly, even if you've never exercised in your entire life and you start today, it's still going to make a difference. Okay. That's good. That's the good news about all this. I really wanted to emphasize this because I want you to know that for yourself or for your family or friends, or anybody who's had a hospitalization, this is very, very important. During periods of inactivity, older adults lose muscle mass and strength more quickly than younger people do. So we used to say this in Georgetown when I worked in Georgetown Hospital. For every day you're in bed, you need 2 weeks to recuperate for that single day. If you're in the hospital for 5 days, you need 10 weeks to recuperate and try to get back to where you were beforehand. So when you get home from a hospital, from rehab, friends, family, anybody like that, please let them know to be extra cautious because it's going to take them a little while to get back to where they were and to just be patient with themselves, okay? Very important. What else happens when we get older? We get a little bit more fat, and we talked about this a little bit in the nutrition presentation, and that it's okay. Like that's what happens, and that's fine as long as it's not an overwhelming, because too much can cause trouble metabolically and of course with your skeleton and just being able to get around. And as we talked about before, a healthy diet and exercise can help with that. All right, the next thing, the eyes. A lot happens to our eyeballs actually as we get older. And this is explaining why it becomes more difficult to see the way we used to see when we were younger. So I think you'll see a consistent theme in a lot of these things is the decrease in the number of cells of the organ or whatever it is we're talking about, and a little bit less elasticity. Those are sort of like the two common themes among everything I'm talking about. So for the eyeballs, that's exactly the same. There's a little bit less elasticity. So your pupils and your lens are not moving as quickly or as well as they were before, which affects your ability to see, particularly in low light. The number of nerve cells are decreasing, so you're not getting a good feedback from your eyeball to your vision center in your brain. You might get dry eyes. So these are things that are naturally happening and can explain why our vision is changing as we get older. So some of the changes we have, loss of near vision, I don't know how many of you like me have reader glasses all around the house because I can't see a single thing that's near me. Brighter light and changes in color perception. So there's nothing we can do to change this other than change our behavior, our environment, because our eyeballs are changing regardless of what we do. Now we can protect them with sunglasses. A lot of optometrists and ophthalmologists will recommend wearing sunglasses outside, but that's not really going to make a big difference as far as these types of changes. I really want to bring this part up too. A slow reacting pupil means that you are going to have some difficulty going from dark to light or light to dark. So I experience this often now when I'm driving into an underground garage. Like let's say it's a bright sunny day and I pull into an underground garage and it goes from bright sunlight to total darkness. I'm totally blinded. I can't see what's happening in front of me. So I have to take a few seconds before I go down the ramp and hope that nobody behind me is annoyed or hope that there's nothing in front of me that I can't see, because it's absolutely a fact that it's becoming more difficult to accommodate to those instant changes in light. So again, this goes back to the mindfulness conversation, be aware of your environment, take your time. It's okay if you need a few extra seconds to accommodate to whatever change is happening in your environment. Another thing that's happening is depth perception and distances are changing our ability to perceive that. So be careful on stairs, especially new stairs that you're not aware of, anywhere there's a change in height. Just be mindful of that. Oh, and there's more. So we may have floaters. I think some of you may have them, dry eyes, those kinds of things. Please talk to your vision provider about any of those things. Oh, there's even more. There's a lot going on with eyes. I forgot. So this is the appearance of eyes. So your eyeball actually may change the appearance. They may become a little bit more yellow. You may have splotches of colors. Your lower eyelid may droop down a little bit. Your eyebrows may droop down. All of this is normal aging. But again, anything you're concerned about, please follow up with your vision doctor. It's particularly the yellowing of the eyeball, because I know all of you know that if you have any liver disease, that's one of the places that it'll show up. So be mindful of that. All right, let's move on to the ears, nose, and throat. So as you know, we start to lose a little bit of hearing. They say a lot of it is probably due to lifetime noise exposure, but there's of course some natural things that are happening as well. And some of the common causes of hearing loss can be from earwax, a benign tumor, and certain medications. Now, the earwax is important because luckily that is something we can pretty easily change, right? So if you feel like things are muffled and you're not hearing as well, just have a doctor take a look at your ear and try to clean it out for you and see if that helps. I thought this was really interesting, and it made me laugh because I can imagine after today's presentation, you'll feel justified in telling your family and friends to speak more clearly, because the truth is that as we get older, things start to sound more mumbled, and that's because we start to lose the ability to hear high-pitched noises first. And as it turns out, consonants like, B, C, K, T, those kinds of things are higher pitched than vowels, which actually I just learned doing this presentation. I didn't realize that. So when somebody's talking to you, if they're not articulating clearly, you might just hear the vowels and not hear the consonants, which would make it a very confusing conversation, right? So when people are talking to you and you can actually you can hear they're saying words, but you just don't understand what the words are, one thing you should do is ask them to articulate more clearly and not just speak louder. See if that helps. See if maybe if they speak a little bit more slowly and a little bit more clearly, if that helps. If it doesn't help and people are speaking words to you and you don't understand them, please follow up with a physician, because that could be something else. But hopefully it's just a matter of telling your kids and your grandkids to enunciate. We also will have trouble hearing or discerning conversations in loud places in groups because of background noises. That's just something that happens, and you just have to change your behavior or do what you need to do to manage that situation. The things that are not normal that might happen with our ears, as you know, our inner ears have a component that helps with balance. So if you have any dizziness or vertigo or tinnitus or those sort of things, those are not necessarily normal parts of aging. So make sure that you follow up with your physician about those, okay? Okay, so what else is declining? Our sense of smell is declining. So food doesn't necessarily taste the same. I think we spoke about this in the nutrition one as well. And our taste buds are not as sensitive. So unfortunately, between the combination of smell and taste buds, things are changing a little bit. But the change is slight, as you can see, usually affecting only subtle smells. But foods may tend to taste a little bit more bitter or a little bit more bland than they used to as we get older. Sometimes some people think this is why people have a decreased appetite, because food just doesn't taste as good as it used to taste. And this is where it's important to start experimenting with herbs and spices and hot sauces and whatever makes you happy, to try to give your food a little bit more zing, not salt, but other types of things, to see if that will help it taste a little bit better. Another thing that happens is we produce less saliva and our gums recede. So the combination of those two things can really lead to some tooth decay. So regular dental care is very important. It's actually extremely important because I think you may know, but the bacteria that we can develop in our mouth, if it becomes systemic, it can be very dangerous. So you really do want to make sure that you're getting regular dental care. All right, moving on to the skin. Of course, we know it becomes a little bit thinner. We get some wrinkles. Some of that's because we have less fat under our skin. We have less elastin, the elastic and the collagen and elastin change and they become less flexible. So as a result, our skin may tear more easily and it may be less sensitive to pain, temperature, and pressure. So we're going to go back to mindfulness for that. Like really make sure that you're paying attention, that you take a look, at your skin, at your body, do some regular checks, make sure there's nothing happening that you didn't see happen, and just be mindful of that. This is very important as well. And I want to emphasize this week. The number of sweat glands and blood vessels decreases and blood flow in the deep layers of the skin decreases. So basically, our ability to move heat and to cool ourselves decreases as we get older. So you have an increased risk of heat stroke. So it's very, very important to make sure that we've already talked about that with the other organs. Skin is actually an organ that you're being super mindful of heat stroke, okay? We're also less protected against UV radiation, and we have less absorption. Our skin is less able to form vitamin D from sunlight. So just make sure that you're using sunscreen, that you're being mindful of that you talk to your physicians about vitamin D because it's such an important vitamin for so many parts of our bodies. Okay, the brain and the nervous system. The good thing is that even though we might lose some cells, our brains are phenomenal organs that I think that the medical field and science doesn't completely understand by any stretch because it's such a complicated, phenomenal organ. But the good news is that as cells are lost, new connections are made between the remaining nerve cells. So we have a lot of what's called neuroplasticity in our brains. So it can typically still function and figure out ways to make things happen, whether it's new connections, other areas of the brain, whatever it needs to do to continue to function and help you be functional. So cognitive and physical exercises are so important for this to maintain the connections, to create new connections, to make the other parts of your brain healthy. Very, very important. The other thing is that our brain has more cells than it needs. Same thing with your organs. There's, the organs was a reserve. This is redundancy. So if you lose some cells in one part of your brain, another part of your brain can take over and compensate for that. So, this may be where maybe somebody that's had a stroke and it has damage in one side of the brain, but they're able to regain function. It may or may not be that side of the brain healed. It just may be that other parts of the brain have taken over for that function. So that's all good news. Our brains are pretty phenomenal. So please take care of them. Do your cognitive exercises, do some physical exercises to take care of them. And good nutrition. As far as this is really talking about the response of the nervous system. So basically, things slow down. Our messages slow down a little bit. It's because of different decrease in nerve cells, decrease in blood flow, other things. The short and long of it, though, is that even though we're not maybe reacting and doing things as quickly as before, you can still do things well. You just maybe have to let your friends, family, whoever, yourself, be patient. You can still do everything you need to do. It just may be a little bit slower because things are just moving a little bit slower. And that's okay. Again, we're going to talk about mindfulness, right? Like just take your time and it's okay. Your spinal cord cells tend to change, but that doesn't seem to affect anything. Your nerves may conduct signals a little bit more slowly. This is usually minimal. I think I did talk about this, though, in terms of the communication from let's say your peripheral, from your legs back to your brain. The reason this is important, though, and the reason why this slower response from your periphery is important is because if you start to fall, again, you're going to react a little bit slower than you might have when you were younger. So we really want to try to minimize those situations where we are trying to react quickly, if that makes sense. Okay, the heart. There's a lot with the heart, and I'm absolutely not a cardiologist, so I'm just going to read what's here. But please, anything with your heart, I know to follow up with your physicians and your cardiologists. But basically what happens is that our heart gets larger and thicker. It doesn't necessarily pump as well as it used to. And so this may lead to problems with your heart, particularly if you have other what's called comorbidities, such as blood pressure, obesity, and diabetes. So these are normal, your heart is normally changing as we get older. But if you have other conditions, please just, continue to follow up with your physicians about that. What's interesting is that our heart rate is actually a little bit lower as we get older, and our heart rate doesn't increase as much when we exercise. Now, the blood vessels, we spoke about this before, I think. They become thicker and they become a little bit less elastic, right? So they're not able to change to accommodate to a change in blood pressure as quickly as they used to. In that sentence there, it says older people are at risk for dizziness or in some cases fainting when they stand up suddenly. I know we've talked about this, so again, I have some questions for you. And we can go ahead and use raise the hand. So just bonus, if anybody remembers the name for this dizziness that happens as we change positions.
And please raise your hand if you would like to answer one of these questions. Thank you, Mr. Harrell. What do you say?
Let somebody else is first. Syncope.
Syncope, yeah, that could be. So syncope is actually the passing out from this. Yeah, that's one thing that can certainly happen. Yep.
Yep. And then thank you, Mr. Harold. What do you say, Ms. Burnett, for either question?
Vertigo?
Vertigo might happen. So the vertigo is happening likely more from the inner ear imbalance than from your from the changes in your arteries. But that's definitely something that can happen. If anybody doesn't remember that, I can say that we'll give you a chance, Miss Doris.
Yeah, what do you say for either question?
Well, I experienced the vertigo, and then I found out later on that I had dry blood up in my brain, and I had to have brain surgery because I kept having vertigo.
Okay. Well, see, that's another reason to have vertigo. So that wasn't your inner ear. That was something. So I'm glad you got that checked out. That sounds serious. So the term that this particularly is referring to is that orthostatic hypotension. And that's the decrease in your blood pressure as you change body position. And so we talked about this when you go from laying down to sitting up or from sitting to standing. So do you remember some of the tips we talked about if that's a particular thing that you're dealing with, like the dizziness when you go from laying down to sitting up or from sitting to standing?
That's a general question for the group, is that right?
Yes.
Any responses to that? Can you say that one more time, Tori, please?
Yeah. So what are the tips that you would recommend or that we've spoken about if you experience that dizziness when you go from laying to sitting or sitting to standing?
Thank you so much for that. Gracie, what do you say?
Well, I think, Tori, I told you I passed out when I got up too quick.
Yeah.
So they told me next time when I get up, sit up, and wait for a little while before I stand. And when I do stand, don't move so quickly, but take my time moving. And because that's what I passed up. They said I got up too quickly and moved too quickly.
Yep.
So,
yep. So you had the syncope, you had the passing out from that. So that's, yeah.
Uh-huh.
Yep.
That's why I fell. Yeah.
Uh-huh. Any
So
other tips?
taking my times when I
Taking
do
your time.
sit
Yep.
up, for a while before, standing up. And then when I stand up, give myself a few seconds before I move. And
Exactly.
when I
Yeah.
feel steady, then make my move, and that should be okay.
Right. Exactly. So that exactly right. And that goes back to that sort of mindfulness and patience, right? Because our
Right.
bodies are changing. We can't affect that. We can't make our arteries any more elastic. It's just a fact of life, right? So all we can do is change our behavior and be a little more mindful. Yep.
Mhm.
That sounds great. Thank you.
Thank you, Gracie.
Welcome.
Any other additional ideas?
Yep. Greer, what do you say?
Good afternoon, all. I was going to say, be mindful of moving suddenly. Don't make sudden moves. Just as similar to what Gracie said, we're not as young as we have been, and so we shouldn't act on a sudden with great suddenness when we're making our moves, standing or whatever moves that we do make. We need to be mindful and more careful than what we've had to be in the past.
That's right. You're right. You're right. Thank you, Ms. Greer. Yeah, that's true. So now you know why. It's because your combination of things, right? Your arteries are not as elastic as they used to be. Your muscle fibers are not moving as quickly as they used to be. Your nervous system isn't communicating as fast as it used to. So there's a whole bunch of stuff happening, which we have no control over that. So we only have control over our behavior. So taking your time, making sure you're not dizzy before you stand up particularly or start to walk. You can also, when you're sitting at the edge of the bed, you can pump your ankles a few times and try to get that circulation going. That's something else you can do. So great.
We have Brenda to share a tip. Thanks so much for sharing.
Well, I just wanted to say to manage your dizziness, you can use a walker or a cane or, the handrails to help you get yourself together.
That's true. That's a good one, right? Have some supports nearby to give you some support. Well, yeah, that's a great idea. Thank you. All right, cool. Well, we're going to move on. Okay, so this talks about blood pressure and things. I'm actually not going to read this, but it just again talks about the fact that our arteries and arterioles, so those are the smaller ones, are less elastic as we age. So things are changing. So you can read this on your own. However, good news, as usual, many of the effects of aging on the heart and blood vessels can be reduced by regular exercise. Exercise maintains cardiovascular fitness as well as muscular fitness, and it's beneficial no matter what age we start. So we're back to exercise. Okay, our lungs, what's going on with our lungs? As with everything else that we've talked about, they become a little less elastic. So we're, maybe slightly less difficulty breathing, slightly more difficulty breathing, I'm sorry. We're gonna talk about this, but you're gonna be more susceptible to any sort of respiratory illness as a result of this. Also your diaphragm and the muscles between your ribs, which are all important for respiration, are also getting a little weaker, I'm sorry. So you may notice that it's just you have a little bit less endurance, a little bit less breathing. Breathing at high altitudes may be harder. So if anybody's planning on climbing Mount Everest, just be aware it's going to be a little bit more difficult for you. The important thing here is the lungs become less able to fight infection, okay? Your cough may not be as strong, your lungs are not as elastic, so please be very mindful of when you have a respiratory infection and consult with your doctors so that it doesn't develop into pneumonia or something like that. Good news is our digestive system really doesn't change very much. For the most part, things just work as they should. There's a few small changes that we spoke about before and we'll go over again, but not much that we really need to be concerned about. You may notice that you're less able to manage dairy products because our bodies may produce less lactase, which digests dairy. So that may be something that you notice. You might notice that things, we spoke about this before, things are moving a little bit more slowly. So this might contribute to constipation, which is something you can manage. The liver is not, let's see, less blood is flowing through your liver, and the liver enzymes are not working quite as well as they were. So basically, the only thing you need to know about this is that the effects of medications, both the ones that you were planning on and any unintended side effects, are going to last longer. So we can't change that. We cannot change how our liver functions. We can try to take care of it with diet, but we can't change it. So just be, again, very mindful of any effects from your medications. Okay. Our kidneys, they're working great. They are assuming no diseases, as we spoke about earlier. They're designed to sort of last for as long as we need them. But you still want to make sure that you're staying hydrated, because they may excrete a little too much water, a little too much salt. So you want to make sure. We talked about hydration in the past. Now, we all know that things are changing with our urinary tract, however. This is different than our kidneys. We all know that the maximum volume of urine that our bladder can hold is a little bit less. Things may happen that we're not expecting, as far as like when their bladder contracts, the bladder muscles weaken, all these lovely things that happen, right? So really the answer to this, in many ways, you could follow up with a pelvic floor physical therapist, they're called, and they can do some specific exercises with you to try to work on any incontinence or issues with your bladder. There are, of course, medications that some people are on and that you can speak to your doctor about. Really, one of the easiest things you can do at home is just have a regular voiding schedule. So even if you're not sure if you have to urinate or not, but it's been a couple of hours, it's a good idea to go. And then that way you're not sort of dealing with these situations. And one of the reasons maybe you don't want to deal with these situations is because you don't want to be running to the bathroom, because we know that may have bad consequences. So really trying to make sure that you're paying attention to how often you go, so that you're hopefully managing as many of these symptoms as you can. In women, there's changes to our urethra. There's no specific changes in our urination as a result of that. However, men, as you all know, there's the prostate, which can cause some difficulty with actually emptying the bladder. Very important, if you feel like you still have a full bladder and you can't empty it, absolutely needs immediate attention. Okay. And even though this is not part of these slides, I think I've spoken in the past about urinary tract infections. For some reason, as we get older, we have less symptoms, which is in some ways a blessing, because they're pretty horrible symptoms, but it's definitely not a good thing, because urinary tract infections can be so devastating. And so just be very, very mindful, again, of your hydration. Okay. Any sudden changes in cognition, balance, strength, anything like that, please see your doctors right away and have them do a urine analysis just to make sure that's not what it is. Okay, our endocrine system, these are our hormones. So as with everything, things are changing. As a result, you're gonna have decreased muscle mass, dehydration is more likely. Insulin, as you all know, anybody that has diabetes, this is really important. So may or may not have less insulin. I think that this is very individual to talk to your doctors about, but things are definitely changing, right? For diabetes, they do say exercise and diet, particularly if you have type 2 diabetes, is important. So we're getting back to exercise and diet, right? Blood production, nothing that we can do anything about. There's fewer blood cells being produced. It's generally not a big problem. Where they say it's a problem is if you have anemia or something where your red blood cells decrease, it might take a little bit longer just to get them back to normal levels. But generally, that's nothing to worry about. Our immune system may slow down a little bit as we get older. So things that are common, cancer is more common as we get older. Interestingly enough, this statement says that we don't respond to vaccines as well as we used to when we were younger. However, they're just as important, because things like flu, pneumonia, and this was probably before COVID, can be so devastating on us. So it emphasizes the importance of getting the vaccines, even if they don't work quite as well as when we were younger. Again, pneumonia and the flu, we are more susceptible as we get older to the severities of those. So please be very cautious of that. All right, those are all of the changes that we had. So the good news is we're going to talk about the good news. People who exercise are healthier than those who do not. Exercise has established health benefits, including improving and maintaining the ability to do your daily activities, maintaining a healthy weight, and helping prevent or postpone disorders. Okay, so there's 4 types of exercise, and I do think that we've spoken about this before. Really, ideally, if you can do all 4, it would be great. Of course, you're not going to do all 4 in one day, so maybe one day you'll do one and one the other. But anyway, the first one's endurance or cardio. So the video we did this morning was specifically, not this morning, a little while ago. The video we did a little while ago was specifically cardio. So you can do cardio aerobic exercises while you're seated, and it just means getting your heart rate up a little bit, okay? Muscle strengthening, doing things with a little bit of resistance. Again, that can be as simple as a soup can in your home to dumbbells to those resistance bands. Balance training, very, very important, as we've spoken about, Tai Chi being one of the really good ones. And flexibility, doing some stretching, doing some yoga, doing whatever it is. But really, you want to try to do all 4 of those if you can. As I said, not all in one day, sort of switch it up. So every day is interesting and every day is new, and you're trying to hit all 4 of those areas. So they had something called the Fountain of Youth on their site, and they said that these 3 strategies may help people live longer: exercise, follow certain types of diets, and eat fewer calories. Before you change your diet significantly or eat less, please talk to your physician. Exercising as well. But the good news is, again, a lot of these things, although we don't have control over all of them, we can certainly mitigate the risks, right? All right, so I have 2 slides here. The first one is, what can we affect? So what I mean by this is that with all the changes that I just told you, decrease in muscle mass, decrease in response, decrease in endurance, your organs not functioning quite the same as they were when we were younger, all those things. What things are we able to change? What things are we actually able to slow down and affect a change of? Because there's things we can change and things we can't change. Like we spoke about vision. We can't change the way our eyeballs are aging. That's just going to happen. But there are some of these bodily changes that we can affect, and we can slow down the change. Can somebody tell me what some of the things are we can do?
Yep. And please raise your hand if you would like to share your thoughts. And things, again, that we can do to help us in our daily lives. Gruyere, what do you say?
I think we can watch what we eat, be mindful of the things that we put in our bodies that we know that's that mix against the things that will affect our bodies adversely. Just be mindful of our diets and how I think we should be mindful of, I take a lot of vitamins. I take vitamin D and a lot of the exercises, a lot of the vitamins that I've been taking off and on down through the years. And that's helped me, I think, quite a bit. And I haven't had any real bad illnesses, and I'm grateful for that. But I think our diet, what we eat is very important.
Yeah, thank you. I totally agree. And that's why we did a session about diet. So absolutely, like having a nutritious, well-rounded diet is very important, and we can certainly affect some good things with that, our cardiovascular health, things like that.
Yes.
Thank you, Greer. Next up is Geraldine. What do you say?
Did you say Geraldine?
Yes. Hey, Gerald, what do you say?
Yeah, well, we can affect influenza and shingles and COVID by taking the vaccines, and that's important. And we can affect the last thing is we can affect type 2 diabetes by, as Greer said, watching what watching our diet, and doing exercise, and that helps with the type 2 diabetes.
Mhm. Yeah, yep, that's right. Yeah, the vaccines were very much stressed, and that, as you saw, because we can't change how elastic our lungs are, and we can't change the fact that our diaphragm, our breathing muscle is weakening. There's nothing we can do to change that. So you want to
No,
make sure that, yeah, you want to make sure that anything that's compromising your lungs, you can minimize that as much as possible. Yeah.
that's right.
Mhm.
Thank you so much, Geraldine. Our last hand up that we see is Miss Wilda. What do you say? We'll have
Hi.
Ann first.
Yes, this is very excellent for me because that's exactly what I'm going through right now. All of a sudden, my body is completely changing.
Mhm.
I wanted to say that everyone said the things I was going to say, but the only thing I didn't hear was exercise.
Thank you.
Exercise, we can affect
Yes.
a lot of what we're happening to us. I'm personally having the dizziness, the incontinence situation really bad. And then staying in contact with our doctors, listening to our bodies. If you listen to your body, more time it'll tell you what's going on. And if we communicate those things with our doctors. But I'm having I'm laying down right now. I almost hate to stand up. It's so difficult to stand up and move around. I've been diagnosed with the sinusitis. So one doctor gave me amoxicillin for that. And I also have COPD, so the other doctor gave me erythromycin for the COPD. So I'm now trying right now to get in touch with my doctor to find out, well, do I take them both? Both of the same medication. One is 500 milligrams and one is 250. So I don't know. So, but this conversation is excellent for me is so reassuring that I'm not going crazy, because when I stand up, oh my gosh, it's like I'm holding on to the rail. I'm pressing to just move around these days. And so thank you for this information. It's really helping me to understand, what's going on with my body and what to communicate to my doctor. So thank you so much.
You're welcome, Ms. Bud. Thank you so much. And yeah, I'm glad that you said that you don't want to feel like you're going crazy, because my mother, as you all know, I bring her up in this a lot. It's 82 this year. She's feeling the same way. Like, she has less endurance, she has less muscle strength, and she's frustrated, and she feels like she's going crazy. Like, we've been to the doctor so many times to have things checked out.
Yes, I have too.
Yep. And not that you shouldn't have them checked out. I'm not saying that. Please do. But once things get ruled out, know that some of it is just getting older. And so, yeah. And so she felt like she was going crazy as well. And I totally understand that. For your dizziness, it sounds like they diagnosed you with a sinus infection, and that's what the antibiotics are for. So I'm glad you're following up with them. Just please continue to do that. Yeah. Thank you.
Thank you for sharing that. I really appreciate it. And keep in mind, wow, we're flying by through with the time. We're almost out of time. But again, thank you all so much for sharing all of your thoughts and comments today. Anne, did you want to share something? Again, what can you do to help you with your body and your daily life?
Well, what I do is I do a lot of the things that some of the other people have said, but I'm on taking vitamins, and I keep up with my doctor, and I do follow different things. And I've found that the chair exercise, bless you, has really helped me a lot. And I'm glad you introduced us to that. And I'm so glad to see you. And please come again.
I will.
Good stuff.
Thank you, Miss Ann. Appreciate that. I'm glad you like the chair exercises. I'm just going to go to the next slide real quick, Alex, before we jump off, and then I'll stop sharing. But so there's some, we've already talked about this a lot, so I just want to I don't know if there's any other ideas, and I'll share some of my thoughts. But so there's things that we've talked about that you've all shared, which is great. Like exercises will in fact slow the loss of muscle mass. So it's really important. That's a big change we can affect. Proper nutrition can really make an effect on the changes in our cardiovascular system. That's great. But there are things like we spoke about, no matter what you do, no matter how many exercises, no matter how well you eat, you're not going to be able to change. One of those being your vision, your eyeballs. So like for me, for example, I explained when I drive into a underground car garage now, I have to go more slowly than I used to before. I have to have reader glasses all around the house because I can't read things as much anymore. Do you guys have any other suggestions of those types of behavior changes that you would recommend where you can't change the situation? You can't change your lungs, you can't change your eyeballs, you can't change those things. What kind of behavior changes would you recommend?
Please raise your hand if you'd like to share. Just really quick, Tori, because I think it's just so pertinent to what you talked about today. Just mentally, just realizing what you can and cannot change and just focusing on the things that you can change. I think that's helped me in my daily life because you can't change everything that's around you. You can just only focus on the things that you can change in your own life. And it's very helpful because you're mentally just thinking about a few things versus everything. So I think that's very, very helpful. Just yeah, the mental thing, because that's plays a very important part. Any thoughts or any behavioral changes that you think we can make to help us in our daily lives? Anyone would like to share? Thank you, Miss Doris.
One of the things that I deal with, I wake up every morning, my eyes be red like fire. And I haven't found out from the eye doctor what's causing it. And I don't know what caused it, but I use a Lumify, and that clears the redness up. But it's not stopping the eyes from running, in the morning.
Yeah, I'm afraid I don't have any advice about that. That's a change in your eye that, yeah, hopefully they can figure out for you.
Thank you, Ms. Doris. Again, any behavioral changes that we think we can make ourselves to help us in our daily life? Dolores, how are you?
I'm fine. Some of the changes of behavior, we need to make time to just do a little exercise to keep our body going and moving, and just a little walk that we can take to help make it better.
Yep. Exercise, walking. That's absolutely, yep.
Thank you, Ms.
Thank you.
Dolores. Really appreciate it. Yep. And as always, don't forget to lower your hand so we can make sure we hear from everyone. Hi, Ms. Walda. Again, would you like to share a behavioral change that we can make to help us improve our daily life?
Yes, I was going to say that one of the things that I do is do a little bit, sit down. Do a little bit, sit down. Do a little bit, sit down. That's the most behavior change that I found that really works. Don't try to. I have 13 steps I have to walk up, so I walk up 4. Wait a minute, 4 more. Wait a minute, 4 more. Wait a minute. Get to the top and just wait, stay there for a few minutes. Then walk around to my room. So that's the one behavior change I thought I wanted to just share. Thank you.
Yeah, thank you. That's great. So it sounds like you really listen to your body. You don't push it. You're still able to do what you need to do. You're just doing it a little bit differently. That's great.
Thank you, Ms. Wilder, for sharing. Appreciate it. Yvonne, what change would you like to share with the group?
Okay, thank you, Tori. This has been great information. Well, I've noticed that my food, my taste buds apparently have become less effective. And so I'm trying to acquaint myself with more herbs. to
Nice.
use because I enjoy cooking, but I've detected less sensitivity to taste. So I'm trying to avoid just adding salt and using more herbs or substitutes that can take the place of salt to enhance the taste of foods.
That's great. Yeah, that's something that I think we don't talk enough about. I'm putting the PDF in the chat, by the way. Yeah, I think that's great because we don't want to add more salt, but certainly if our food is not tasting as good as it used to, like what can we do? And I'm so glad to hear you experimenting with that. That sounds good.
Thank you.
Thank you, Yvonne. Oh, Tori, I think you sent
see
that
that.
to me
Yeah,
direct
I see
message,
that.
but I just
Got it.
reshared it. Oh,
Oh, you shared it.
I
Okay.
did it myself as well. I put it as
Okay,
a
I got it. I got it. I got it. No, I don't. Why does it keep defaulting to that? Okay, now I got it. Okay, so attached there is the PDF of my slides from today, so you can read it later. I know it was a lot of information and I didn't read them verbatim, so you can read them later.
Thank you, Tori. Again, when you tap on the PDF file in the chat, just hit the three dots at the top right. You can save it to your Files app. But this presentation will also be up in YouTube, so you can review it there as well. Thank you. We have two hands. Again, thank you so much for sharing. After these two hands, I think we'll be done for the day. Louise, any I think behavioral changes that you wanted to share with the group?
Yeah, I use a lot of spices also, but not salty stuff. And with urinary problem, I do the Kegel exercise. And when I think it, I have to move. I don't wait till the last minute. I went to church with a friend and she said, "Oh my God, I needed to go." And I sit talking and now it's too late. I said, "Oh boy, not at church." So
yeah.
I did get a therapist to give me, she said, if you're washing dishes, you turn the water on and when you turn that water on, you feel like you have to go. She said, you count to 8. You say you go 1, 2, 3, 4, 5, 6, 7, 8. Take a deep breath. It distracts you and you can get where you're going without getting incontinent. And so I practiced it a lot. And even if you're standing in line in the store, sometimes you can just practice it, but it works for me because I practiced it. She told me about it. I did go to the doctor and complain about all the trials I go through with that. These people just harass you. And I practiced that exercise along with the Kegel exercises too. So, and I also put a new bathroom in on my first floor because I figure, what do I have to lose? I make a little bathroom. It's just a powder room enough for me to get to from the kitchen instead of going up and down the steps, So you make the adjustment. Yeah. Thank you so much.
Thank you for sharing. Those sound like great tips. So you went to one of the therapists that I was mentioning. So yeah, you'd be surprised that you might still have more control than you realize if you go to one of these pelvic floor physical therapists.
Yeah.
They can give you some specific exercises to help. But yeah, like being mindful, making sure that you're going more frequently, even if you don't feel like you have to go, go before it becomes urgent, and try to go every couple hours or whatever makes sense for your body. Yeah.
And don't drink water late at night, like 8 o'clock I cut off because then you'll end up with problems in the night. So I don't like to drink after 8 p.m.
Yep, as long as you're keeping hydrated during the day, that's fine.
Yeah, you drink all the water you want from starting when you wake up. And don't drink a lot of water after 8 o'clock. Then you're gonna end up jumping up in the middle of the night.
Right.
Thank you, Louise. Really appreciate it. Our last hand for the day. Again, we are running out of time. Thank you so much for all the comments and answers today. Ms. Laverne, what is your change that you would like to share with the group?
Hey, Tori, I'd like to say thank you for everything, dear heart. And the exercises are very welcome because I've been trying to get physical therapy.
but I have no luck yet for some reason. I don't know what's wrong with them doctors. But I would like to say, as far as my mental state, to keep me sane, I play with YouTube and listen to the music, and that helps keep me calm and keep me in a space where I don't have to deal with thinking about all the negativity.
Thank you for sharing that. Yeah. I mean, you're right. I think we might have a subject about mental health. I think we do, right, Alex? But yeah, that's such an important component of our overall health and wellness, isn't it? Like, it's such an important component. We'll have a whole conversation about that. For me, I don't know if I told you guys, but I stopped watching the news. Like, sometimes ignorance is bliss. Like, for me, that's my bliss, is to not be aware of the things that I have no ability to change. And so that's been really helpful to me. But thank you for sharing that. It is actually a very, very important part of health, is taking care of your mental health.
Thank you so much, Miss. So I think that brings us to the end of our session today, Tori. But thank you so much for the information. I loved how you talked about each of the body parts and the organs, and most of the things happen just because of age and just how the human body works. Just doing those little things that can really help us later or even now in our lives, with just some of those small but very important tips, as Yvonne just shared in the chat about sunscreen and sunglasses. Those little things can really make a big difference. Any last thoughts or any final tips or any summaries you'd like to provide about your session today, Tori?
I was thinking about what would I say? So I think the most important thing I hope that you all always take away from my sessions is that you're empowered to take care of your health. Like, you really do have more power over your health than you may realize. And even if it's drinking an extra glass of water or putting on sunscreen or pumping your ankles, whatever it might be, any small little thing you do is positive. And so please try to make sure that you feel empowered to do those things that make you feel good.
Yes, one small thing a day can make it a whole month. One small new change a day can really make a difference. So
yeah.
Thank you so much, Tori. As always, we look forward to your next presentation next month. We hope you have a wonderful 4th of July holiday, because we won't see you for a few weeks until after that. But thank you so much for coming on, and we certainly learned something new today. Let's all thank Tori for coming on, and make sure you stay on to complete the poll to let us know how you felt about today's session. Thank you so much, Tori, and have a wonderful rest of the weekend.
Thank you for coming on.
Thank you, Tori.
Thank
Thank
you.
Bless you.
Tori,
Bless
thank
your
you.
heart.
Good information, Tori. Thank you.
Thank you.
Yes, thank you so much.
Absolutely
Thank you.
excellent.
So nice to
Thank
see
you
you
so
all.
much.
Good
You.
Thank you
information.
very much.
Hey.
It really helped my self-esteem. It really did.
Hey.
Oh, good.
Repeat.
So much.
Oh my goodness.
Good information.
Yeah,
Very
great
good
information.
Have
information.
the rest of your day.
Good reminder.
All right.
Yeah.
Thanks, everybody. Until next time.
Bye.
Bye.
Bye. Bye.
Okay, bye-bye.
Bye, Tori.